better outcomes in patients. We can do these surgeries through smaller incisions. The patients recover faster, they have less pain, and the results are more predictable. So I'll just show you how it works. So typically, this is a model of the spine, and what the robot helps us is get extreme precision in the placement of implants, which helps stabilize the spine and correct spinal deformity. So this is what the robot does. Of course, eventually it will help us in, along with AI, even decide how to give a shape to the spine with the correction.
Decade முன்னாடி பார்த்தோம்னா surgery itself is there is an evolution evolving in the last 20-30 years. ஒரு 25 வருஷத்துக்கு முன்னாடி இப்ப appendix ஆபரேஷன் பண்ணோம்னா abdomen ஓபன் பண்ணி தான் ஆபரேஷன் பண்ணுவாங்க. அதே ஒரு 15-20 years முன்னாடி laparoscopic system இன்ட்ரோ듀ஸ் பண்ணாங்க. இப்ப robotic system. In the last 3 decades every 10 years we are seeing an evolution in how the surgery is growing. Open surgery, laparoscopic surgery, robotic surgery. World level there is one prediction. In 10 to 15 years time, most of the surgeries will be done under robotics. Robotics illama endha surgery me nadakadhu or 10-15 years time illa. Apollo Chennai region is not adapting robotic technology. I just wanted to say that we are actually leading the country in terms of providing surgical options through robotics. I think that's the biggest thing we are making it. That's the kind of investment Apollo Hospital has done. It's not only the investment of technology, bringing in robots, that's not an investment. Apollo Hospital has carefully devised its strategy 15-20 years ago under the leadership of Dr. Pratap Reddy and VC ma'am and all the promoters to develop this technology and then invested in bringing in talented people from multiple parts in the globe. We have so many surgeons sitting here, got trained, also training for the last 15 years to produce more and more surgeons so that this technology can be offered with safe. If robotics, எதுக்காக நம்ம robotics பண்ணோம் அப்படின்னு கேட்டிங்கன்னா, இப்போ any part of the body, முன்னாடி பார்த்தீங்கன்னா ஒரு particular part மட்டும் தான் roboticsனால பண்ண முடியும். இன்னைக்கு பார்த்தீங்கன்னா 18 ஸ்பெஷாலிட்டியில் நெக்கில் இருந்து ஒரு தைராய்டு ப்ரொசீஜர் கூட இன்ஜெக்ஷனே இல்லாமல் நம்ம roboticsனால பண்ண முடியும். ஸ்பைன் சர்ஜரி ஆகட்டும், knee replacement ஆகட்டும், hip replacement ஆகட்டும், any surgery in the tummy, it can be done robotically. What advantage? Incision is very small, recovery is very quick, blood loss is almost nil. Tough. Even laparoscopy, some of the parts are difficult to access. Robotic surgery, you can on the screen, the display is so clear, surgeons will be able to access the robotic arm easily. One of the myths is surgery robotic procedure is a common question. And the question we are going to answer that question. Robotic system surgeons replace panna poradhu kediyadhu. At the same time, it's like surgeons ஒரு சூப்பர் சர்ஜனை மாத்த போகுது. அதான் பண்ணிட்டு இருக்காங்க actually. Surgeons ஒரு distant patient கூட இன்னைக்கு through robotic system operate பண்ணலாம். எந்த பார்ட்ல இருந்து கூட they can operate. So we have lot of things to do today. We have our vice chairperson here. She will be talking more about the Apollo's commitment in terms of producing more and more fantastic outcomes, clinical outcomes by robotic surgery. Thank you for all your contribution, our doctors. It's an amazing job. Not only the doctors, even the whole team. And a special thanks to all the robotic surgical companies for bringing the technology to India to produce better outcomes. Once again, thank you all for being here. Enjoy the day. We have so much to show to all of you, especially the media. இந்த மெசேஜ் இன்னைக்கு ஸ்ட்ராங்காக பப்ளிக் கம்யூனிகேட் பண்ணணும். சம் ஆஃப் த மித்தை பிரேக் பண்ணணும். அண்ட் அப்போலோவுடைய கமிட்மெண்ட் இன் டர்ம்ஸ் ஆஃப் கிரியேட்டிங் கேப்பபிலிட்டி இன் ஆல் த சென்னை ரீஜனல் ஹாஸ்பிட்டல்ஸ் to treat any kind of disease in any part of the body. That's our commitment today. Thank you so much. Thank you.
I'm just so excited to be here today with all of you. One is, I have to thank the members of the press and the media who've been with us on this journey for 43 years. And that's what Apollo has been. And I also have to say, on the other hand, that it's very rare to get a galaxy at that. So can we give our clinicians a big hand? I think while people talk about assets and people talk about companies and performance, our most valued assets are our staff and our people. And Chairman says it all the time. We can build beautiful hospitals, which I think Apollo loves to do, and we do. And we will always invest in the best technology, whichever is future. Even when I was looking at the Vinci Xi or the SSI robot, I said, what is next? Our next installation will be, which is going to be the best for the next 10 years. So that's how we look at it. We look at AI and say, how can it make a difference in the way we do things and in the way we perform? And we look at our staff and say, listen, what you give our patients in terms of TLC, in terms of kindness, in terms of efficiency, in terms of surgical outcome, it's never enough for us. And they all know it, that if we do well, we have to keep doing better. But you may ask me, why do we do it? Why does Apollo want to constantly do things and do it better? Because it's fine, it's a good organization. It's only because we do it for the patient. The patient is the center of everything which we do. If all these doctors have studied, worked, trained, stand for hours in the theatre, it's only because they want to get better outcomes for the patients. If all the teams, if Ilan came and said, please communicate and please let people know that a robotic is a better option because there's less blood loss, you go home fast, less rates of infection, better outcomes, and deeper and sharper outcomes because they know how to navigate it much better than we can do it with our eyes and hands. They sit behind a council, which you will see, and they do it. So all this is because we really are committed to doing what we can for the patients. And of course, Apollo is our heart, Apollo is our head, and I have to congratulate the team, I have to thank them, because in Tamil Nadu, where we started, it's Namma Tamil Nadu, we have been able to do more than 8,000 robotic surgeries. Nobody has done that. So thank you and congratulations. And Tamil Nadu has supported Apollo, Apollo's mission, Apollo's growth, what it does. But more than anything else, while we have done more than 8,000 in Tamil Nadu, and we have this fabulous group of clinicians sitting with us, all India, from the time we started, we have done over 25,000. And that is the largest series in the country and maybe even in Southeast Asia, this part of the world. And that is because all of them have worked so hard, they've done us proud, and that's really what the Apollo story is. But what has happened is, we were the first ones who even dared to dream and set up a robotic program. And, Dr. Meera, I saw earlier, she was probably one of the first, the guy named Dr. Arthur. They all were one of the first initial team. But from doing, the whole robotic surgeries this way, Dr. Hegde and the author team came back and said, listen, there's a spine robot and that's going to make a huge difference. So then we've invested in that. We continue to do spine. The orthopedic team, who I can see Dr. Shankar, I can see Dr. Madan. The lights are on, so I can, whoever I see I'm mentioning, that doesn't mean I'm missing the others. But having said that, I think it's because the clinicians come back and say, listen, this is the latest, this is the best, this is going to make a difference for us. And that's how these things happen with us. I can only say that, for us as a country, we need to see, we invested in the proton, it was the first, and then one more has come in India, 3 more are coming in India, out of which 2 are with us. But why do we have to invest in this kind of tech? It's only because it's making a difference for the patients, and nothing else matters. It's the patients and it's their outcomes, and that's why Apollo is here to do that. So having said that, ours is the most comprehensive orthopedic program. You know, we can have 1, 2, 3 of the same machines, and we can do that. And the cardiac, I'm so sorry about our cardiac people, both of you are sitting here. Dr. Yusuf has done some phenomenal numbers in the cardiac space. So, you know, the heart has done extremely. Hans here, who's again young and, you know, going to do some wonders with us. So I'm just saying that each one of them have done amazingly well. So the cardiac program, ours is probably, you know, Dr. Sabiki in Bangalore, together, they have done the largest of the cardiac work. The Euro and the GI again has now, you know, it's like a proven standard of care that unless you cannot do a robotic option, which is rare, that you go and do conventional, it's actually now it's become the other way. That conventional can do a certain thing, but the people who are experts on the robotic can actually do it 10 notches, 20 notches better. And that is why it is recommended, because, you know, it gives great outcomes. And the same is for, you know, whether it's ortho or spine or any of these other areas. And almost every system, every frontier has been surpassed with the robotic interventions by all of them who are sitting here. But what is exciting and what is the future, and we have not taken our eyes off the ball, is trying to see how can we use it for brain surgeries, how can we use it for neurosurgeries. I don't have an answer yet, but that does not mean that we're not looking at those aspects. What is going to be exciting, good and futuristic for us, that all the work of everyone who is here will then help people with making better equipment, using it better for AI, because their data and the research volumes which they have all generated as groups has again been phenomenal. So I'm just looking forward to Apollo, India, true Atmanirbhar, you know, making a mark on the global stage. And while I'm saying Atmanirbhar, I'm also very proud that now they're made in India robots. And they're made in India drones, they're made in India robots. So what more can we ask for? That we're all very proud Indians, and we have products which are as good, if not better, made in India. We have talent which is completely made in India. Maybe, you know, they pick up some ideas or something from the Western countries. But what I have learned of late is that people from other countries come to us for training. They ask them and they train them. And that's happening a lot. So truly speaking, I think, you know, we are shining as a country. We're very proud to be Indians. And it's members of the media who really have to tell the rest of the world. So, you know, when you talk about it, the rest of the world knows that, you know, we are really the best in what we do. It's not been easy to take a position in the world's economy. And we are definitely going to be the third largest economy. We will become the second largest economy, and when we become the first largest economy, let's hope it happens in our lifetimes. So I think that is what we have to look forward to. Thank you all for being here, and my heartfelt gratitude from the entire Apollo family for all our clinicians. I'm just so overwhelmed by the number of you, so I may not have mentioned everybody, but I would have loved to have done a roll call for each one of you to thank you for the amazing work you all do selflessly and tirelessly for the institution and more than anything else for the patients. Thank you all and God bless.
அனைவருக்கும் வணக்கம். சென்னையில் இருக்கிற அப்போலோ ஹாஸ்பிட்டல்ஸ் தமிழ்நாட்டிலேயே நம்பர் 1 இன்னும் ரோபோட்டிக் சர்ஜரிஸ். அதுக்காக தான் உங்களை இன்வைட் பண்ணியிருக்கோம். அப்போலோ ஹாஸ்பிட்டல் இன் சென்னையில் 5 ஹாஸ்பிட்டலில் 11 ரோபோட்டிக் சிஸ்டம், 18 ஸ்பெஷாலிட்டியில் மோர் தென் 50 சர்ஜன்ஸ் இருக்காங்க. ஆக்சுவலாக முன்னெல்லாம் பார்த்தீங்கன்னா வயிறு மாதிரி சர்ஜரிக்கு மட்டும் தான் ஆப்ரேஷன் பண்ண முடியும். இப்போ தைராய்ட்லேருந்து ஹார்ட் சர்ஜரி, லங் சர்ஜரி, எலும்பு மூட்டு அறுவை சிகிச்சை, ஸ்பைன் சர்ஜரி எல்லாத்துக்குமே ரோபோட்டிக் சர்ஜரினால இப்போ ஆப்ரேஷன் பண்ண முடியுது. எதனால் இது மாதிரி பண்ண முடியுதுன்னு கேட்டிங்கன்னா, 15-20 வருஷத்துக்கு முன்னாடியே அப்போலோ ஹாஸ்பிட்டல் கம்ப்ளீட் சென்னை ரீஜனில் we have started investing on talent to bringing in talented surgeons. ரோபோட்டிக்ஸ்னால நிறைய அட்வான்டேஜஸ் இருக்குது. பேஷண்ட்ஸ் வந்து சீக்கிரமாக வீட்டுக்கு போக முடியும். பிளட் லாஸ் சர்ஜரிஸு சர்ஜன்ஸ்க்கும் இட் கிவ்ஸ் அடிஷ்னல் பவர். எந்த ஆப்ரேஷனுமே அவங்களால குயிக்காக முடிக்க முடியும். அது மட்டும் இல்லாமல் ரோபோட்டிக் ஆர்ம்ஸ்னால பல பகுதிகளை ஈஸியாக அவங்களால அக்சஸ் பண்ண முடியும். ஒரு 30 வருஷம் பார்த்தீங்கன்னா, ஒரு 30 வருஷத்துக்கு முன்னாடி பல சர்ஜரி ஓப்பன் சர்ஜரியாக இருந்தது. அதுக்கப்புறம் லேப்ரோஸ்கோபிக் சர்ஜரி வந்தது. இப்போ ஃபுல்லாகவே மெஜாரிட்டி ஆஃப் த சர்ஜரிஸ் பார்த்தீங்கன்னா ரோபோட்டிக் சர்ஜரினால பண்ண முடியுது. இப்போ நிறைய அட்வான்டேஜ் இருக்குது, ஸ்காருமே இல்லாமல் இருக்குது. ஆக்சுவலாக இதுதான் மேஜர் அட்வான்டேஜ் ரோபோட்டிக் சர்ஜரியில். அப்போலோ ஹாஸ்பிட்டல் லாஸ்ட்டு ஒரு 15 வருஷத்தில் 8000க்கும் மேற்பட்ட ஆப்ரேஷன்ஸ் பண்ணி முடிச்சிருக்கோம் வித் 50 சர்ஜனை வச்சு, வித் 11 ரோபோட்டிக் சர்ஜரிஸ். ஸ்பைனுக்கு தனியாக இருக்குது, ஹார்ட் அண்ட் லங் அண்ட் அப்டமல் சர்ஜரி தனியாக இருக்குது, ஆர்த்தோபெடிக் சர்ஜரி தனியாக இருக்குது. 3 டிஃப்ரெண்ட் கைண்ட் ஆஃப் ரோபோஸ், 11 ரோபோ வச்சு இவ்வளோ சர்ஜரி பண்ண முடிஞ்சிட்ருக்கு. தேங்க்யூ ஸோ மச். தேங்க்யூ.